The Lake Tahoe Orthopedic Fellowship was #1 on my list because of the training opportunities present here.
We have a long history of excellent orthopedic care here.
It's one of the few places in the country and the world where you can have this highest quality of medicine and live in a rural setting.
It provides top quality, state-of-the-art orthopedic care for our community. For orthopedic surgeons, it's a great place because of the huge volume of recreational sports that are in this area.
You see a lot of overuse injuries and trauma related to more extreme type of sports.
Things like skiing, snowboarding,
Climbing, ice climbing, mountain biking, hiking.
even cross-country skiing and even snowshoeing you see some injuries from.
I really wanted to gain a greater exposure to athletic traumatic injuries.
It's a high volume caseload, and that provides good training ground for the fellows.
So here we're looking into the knee medial side. We can see a torn medial meniscus.
Our fellowship started in 1987, and over the years it has matured into the accredited program that it is today. It is a very intense 12 months of super specialized training in orthopedic sports medicine.
Like make the rotator cuff tear and then do the labral tear. I think the thing that's great about this fellowship, and I actually went through it 3 years ago, is there's a lot of hands-on training. From day one, you are in with an attending and you're doing cases and you are intimately involved in the case.
So now we'll make the second portal.
The atmosphere is really unparalleled, especially coming from residency.
Over this course of the year, you basically develop a friendship with the
You
fellows.
can do cephalomedullary fixation, or you can do just diaphyseal fixation. Surgeons here kind of respect that. You do have a lot of knowledge to offer the group.
They can bring a unique aspect to how we treat patients, and it's certainly something that keeps us at the cutting edge.
They're divided among 7 practicing orthopedic surgeons, so you have 7 different points of views.
It allows me to choose what I think works best in my hands and apply that to my practice as I leave the fellowship.
Fellows, on average, have been involved with a minimum of 500 surgical cases per year.
They're going to get ample opportunities to do ACL reconstructions, rotator cuff repairs, which the majority of us do arthroscopically now. There's going to be a significant number of hip arthroscopy cases. Dr. Rupp does those, and he's really the only guy in this area that does them.
The high volume is a definite advantage to a fellow coming to this program. I've never had a fellow complain that he didn't get to do enough surgery here.
The fellowship has certain requirements that the fellow undergoes throughout the year. There are academic requirements such as research projects. There are clinical responsibilities.
We have conferences every Tuesday morning from 7 to 8 o'clock. There'll be case presentations on some of the interesting cases that have been done in the past week.
So this was a skier versus skier trauma. She sustained a distal femoral fracture on the left side.
The fellows are in charge of that conference. They give talks.
Suprapatellar approached in the semi-extended position. You got the knee flexed about 20 degrees. I enjoy presenting at conference because it charges me with doing a lot of research on a topic. And so I appreciate that it actually allows me to become very knowledgeable about a topic I'm presenting. Fellowship suffering.
We'll get on top of that cuff tissue. There you go.
We have regular cadaver labs.
The best part of the cadaver lab is that consequences are non-existent. And so it affords my mentors a chance to really let us go and work on our surgical technique in a safer setting.
There's your hole.
The training is certainly an evolution throughout the year.
We break it up into 3-month rotations.
3 surgeons for 3 months at a time. We'll notice that our second time around, we'll perform more of the surgeries. We'll have already understood the parameters of what to do in every surgery from our prior rotation. Towards the end of the year, you're really almost functioning in an autonomous manner.
There's no question that the skill set improves immensely over the course of 12 months.
I've really expanded the depth of what I've seen in residency.
When the fellow leaves, they're much more efficient, they're technically better, and they've seen a lot of different cases than they would have in their residency.
The majority of them feel very comfortable when they leave here of going out and doing these things on their own.
We would call this a success.
What I look for in an applicant is somebody that we feel that we can work with for a year and get along with, somebody that would make a good partner.
We're looking at their academics, We're looking at their research interest, and we're also looking at what kind of people they are. I mean, what kind of activities they like to do.
We have had fellows from pretty much every major program in the United States.
And when they leave, they're happy, and 6 months, 12 months later, they realize, it really sinks in what a great experience it was.
The best kinesiology lab in the world is right here in the Sierra Mountains. You can learn about your body, you can get in shape, and you can learn about how people get hurt doing those same activities.
It's not unusual for on an occasional day that if we get out of surgery early to tell a fellow, go get your skis or go get your snowboard.
You can snowboard or ski or mountain bike literally 5-10 minutes from the office.
If you're going to take care of sports individuals, it's important to enjoy sports yourself so you can understand the mentality of the athlete.
Living here has been phenomenal for me. I really couldn't be happier.
Clean air, clean water, and you put a price tag on that. No traffic. Untold recreation at your doorstep.
I don't think I could ever get tired of this place.
The opportunities that you have here are just second to none.